Hi, welcome to Ideal Protein again. Dr. Gabriel Busquets here. So on this segment, I'm going to be talking about some of the most frequent asked questions that I get on the program when people are starting to learn about it. First question is going to be about prepackaged foods. So here's the thing about prepackaged food. The reality is that I'm not a fan of prepackaged food. I don't believe anybody really is a fan of prepackaged food. But the way I see it is really this program is about getting you from A to Z. It's about getting you from the state of health that you are right now and getting you healthy. And we're getting you healthy by losing a lot of weight, which is what this program is about. It's going to help you to lose a lot of weight. Once you get to your ideal weight on phase one, we're going to phase you out of the prepackaged food and get you back into eating normal food, right? And we do it in phases. There's 4 phases that happens in this program. And on phase 2, actually we take away one of the ideal proteins and we reintroduce a normal protein like a chicken or steak or something like that. On phase 3, we take another ideal protein, we introduce another lean protein, and we introduce carbohydrates and grains and things like that. So again, I'm not a fan of prepackaged food, but I think for this program it works great. It has done the job every single time. So another question that I get asked a lot is like, how long am I going to be on phase 1? Well, it really depends on how much you are going to lose. You can imagine that somebody that has to lose 100 pounds, which people do in this program, it's going to be, the amount of time that they're on phase 1 while losing weight is going to be very different from the person that only needs to lose 40 pounds. The average person loses anywhere between 2.5 and 3.5 pounds. Men lose a little bit faster than women. I know that's just, unfortunately, that's just the way it is. Men usually average about anywhere between 3 to 4.5 pounds a week, while most women lose anywhere between 2 and 3 pounds per week. So am I able to exercise? Well, the answer to that question is yes, you can exercise. But here's the thing, this is a very low carb, low sugar diet, okay? So because you're gonna have low sugar running in your system at any given point, which by the way is a great thing, you cannot really just exercise vigorously, really, really hard. So what we try to do while you're in the program, you do not wanna increase your heart rate significantly. So most of the time, if you're a person that's used to exercising on a daily basis or on a weekly basis, a lot of the times what I ask you is to tone it down a little bit while you're in the program. If you're not a person that's used to exercising all the time, I'm going to say for at least the first 2 months of the program, this is not the time to start a very hard workout routine. Okay, you can do small things like maybe like walking or bicycle or just swimming. You can do things like that, things that are like just low impact, just not something that requires your heart rate to increase significantly really, really fast, because it's going to drop your blood sugar significantly and it's just not a good thing. So can you drink alcohol in the program? Well, I think that this should be an obvious one. Unfortunately, alcohol is not only a toxin, that can affect your liver. In this program, actually, your liver is working really, really hard while you're on the program. But it's also a sugar. And of course, all sugars and carbohydrates are restricted while you're on the program, so we can keep you in that state of ketosis that we talked about earlier. So alcohol, unfortunately, it's a no. Now remember, you're not going to be in this program forever. Once you get out, once you're on maintenance out there, you can absolutely go back into drinking your wine or something like that. Can you drink coffee? Well, the answer to the question is sure, yes, you can have coffee. Now we got to think about why you're drinking the coffee in the first place. Are you drinking because you like the taste of coffee? Do you really are a coffee connoisseur? Or are you drinking coffee because you don't have energy? Most people in the program, after a couple of weeks of being in the program, you're going to start experiencing a surge of energy. So a lot of people feel like they don't need that coffee in the morning as much as they used to, which is a great thing. We do think like if you do, for every cup of coffee, you do need an extra cup of water a day. Now, you cannot have a lot of cream and sugar in your coffee, because all that cream that you put in there and sugar, I mean, it has a lot of sugar in it. And remember, this is ketogenic diet. This is a low carb, low sugar. So you cannot have creamer. You cannot have sugar. You can have coffee, but it has to be just coffee. The only thing that is allowed is that you can put up to an ounce of skim milk and maybe 1 or 2 of packets of an artificial sweetener, preferably stevia. But about 1 cup a day, and that's it. So can you have artificial sweeteners? The answer to that question is yes, but there's a limit on how many artificial sweeteners you can have a day. Okay? Some of the food that you are consuming in the program already have some artificial sweeteners in it. So artificial sweeteners, unfortunately, also have an insulin reaction to it. So if you have too much, it's going to kick you out of the state of ketosis. You are allowed, while in the program, to have no more than 4 servings of an artificial sweeteners a day. Now, where are you going to get those artificial sweeteners? Most of the time, if you drink coffee or tea, if you have something like stevia in it, each packet is considered a serving of an artificial sweetener. So if you have, let's say, 1 or 2 packets in that morning, you've already consumed 2 of your 4 allowed packets a day, of servings a day. But remember, if you want to use a dressing while you have your salads for lunch or a dinner, you're going to be the dressings that you're going to be having is either an ideal protein approved dressing, which is an ideal protein brand, or a Walden Farms, which we can talk about that. So you got to look in the back of the container and see how much is a serving, and you cannot pass 4 servings in a day, and that you have to add it to the package of that you have in the morning maybe for your coffee. The same thing if you do a gum. Each gum will be considered a serving of an artificial sweetener, because you would have to do a sugar-free. Although I would recommend really not doing gum at all. But if you have to, for whatever reason, just remember that no more than 4 servings of any artificial sweeteners a day. The ones recommended really only is stevia. I would really stay away completely from anything that has aspartame in it. That is a toxin in the body. It's not good for you. NutraSweet or anything like that.